Okay, Randy, what we're gonna do is look at Evan's ankle here, and we're gonna make believe that he had a sprained ankle. And we see that a lot in basketball players or tennis players, even just everyday runners. We see it often, and most often it's the lateral ankle, not the medial, or the outside ankle, not the inside. And so we're gonna look at that. And again, we got to be careful because there's a lot of bony prominences here. It's a sensitive area, and so just like the hand, we're going to be softer on the ankle than we are going to be in anywhere else on the body. There's not a lot of muscle tissue to cover the bones, so again, it's a sensitive area. Okay, so what we would do is put a dime size Rehab 1000. Look at his ankle, and again, I would probably ask him, Evan, where does it hurt? Most of the time, ankle sprains. And he's going to be sore there anyways. He's a little tender right there. Yeah. That's his tender area for a lot of people anyways. Sore here? Yeah. Yeah. How about back here? Not as bad, but right there and right here. Okay, so what I'll do is I'll put the Rehab 1000 on. We just paint it on there again. And we know we're going to stay more on this outside here, so we're going to come in here. And what I like to do is just bring it up just a little bit. And then I'll point it down. And then I'll point it back up, and I'm trying to find some right there. You can feel that right there? Yeah. And I would just sit there and I would work that area. And a lot of times, we'll even work all the way up this side here, because you have two important muscles here that help with that ankle, so we're just going to kind of scrape those a little bit. And nice and easy. Again, you can go a little more aggressive up here than you can down on the foot itself. And turn your foot in that way a little bit, Devin. That's perfect. And that just exposes those ligaments a little bit. And he's got a little bit of crepitus in there, but not very much, which is good. I'm just going to work that area. He's got a little bit right here.
Scott, I know I asked you earlier, how soon could you treat if from a sprain?
Well, again, if somebody sprained their ankle right away, if you got the first 6 to 8 hours nice and lightly, do the PMT technique lightly, and then follow it with ice, and do that for 24 hours, where you're maybe a little bit of the PMT for 2-3 minutes, nice and lightly, ice for probably 10-15 minutes, and do that 5 or 6 times in that 24-hour period. And then after that, you readdress it. If it's still very swollen like a cantaloupe, get it to see a doctor. Okay. Okay.
In the beginning, if there's some swelling, can you still treat it?
Lightly, you can.
Okay.
But if it starts really getting large and swollen and very painful, you get it looked at. Okay. A lot of times we'll tweak our ankle. We really won't sprain it, and we don't do a lot of damage to it. Then the Rehab 1000 would be acceptable. Right. But again, if you have any type of question whether you really hurt or not, it's best to go see a physician. Okay. Okay. So just work on this a little bit. So that's how I would do the ankle. And then again, this is a good tool to get on here on the side here. That's it. Okay. And we could, if we wanted to, and if it's a chronic ankle sprain, we could actually have Evan stand up for me. And sometimes people say, when I stand on it and I lean forward, I feel like a little catch here. I can actually, this is called closed connect chain, and I could actually do the Rehab 1000 or PMT right on that ligament right there. And then back up. Okay. Right?
Yeah, feels good.